Hi, my name is Chris Farrell, and this is a comprehensive assessment. The first thing I'm going to do is get just kind of when I walk in, get a general impression of my patient. Do they appear to be in any distress? Are they having difficulty breathing? Does their skin pale? Are they sweating? Do they seem to be in pain? Next thing I'm going to do is introduce myself. Hi, my name is Chris. I'm here to assess you today.
Hey, my name is Joey.
All right, nice to meet you. When I talk to them, I'm just going to evaluate their speech. Does it seem to, does he form coherent thoughts? Is he able to speak without difficulty? Is that normal for him? At the same time, when I'm looking at him, I'm going to assess the skin. Do I see anything abnormal? Again, is it pale? Are they sweating? Do they have any kind of lesions, breaks in the skin, any bumps that could cause problems for them? And while I continue to do my assessment of the other body systems, I will continue to assess the skin throughout. After getting my general impression, I'm going to start my assessment, and I'm going to start with the head. So the first thing that I'm going to do is I'm going to palpate his skull, look for any bumps, any lumps. Do you have any pain when I touch you?
No.
Okay. At the same time, I'm also looking at his hair to make sure that there's not any issues there. Is it clean? Do I see any dandruff? Do they have? Do we have any? Is it covered? Good coverage for the hair to see if there's any issues with that. The next thing I'm going to do is I'm going to assess his face. I'm going to look for symmetry of the face. I'm going to ask him to do a couple things. Can you do me a favor and give me a big smile? Show me your teeth. Can you frown for me? All right. Okay. Can you puff out your cheeks? Can you clench your teeth like this? Okay. I'm going to ask you to close your eyes, and I'm going to touch you with two different objects. Can you tell me if what you're feeling is soft or sharp? Okay.
All right.
All right.
Soft. Sharp. Soft. Sharp.
All right, you can open your eyes. Thank you very much. The next thing I'm going to do is assess his eyes. Can you take off your glasses for me for a minute, please? Okay. I'm just going to give a general appearance of his eyes. I'm going to look at his conjunctiva. I'm going to look at his square. Do I see any abnormal redness or yellowing of the eyes? I'm going to look at his lacrimal ducts and see if they look to be patent. After I give a general appearance of the eyes, I'm going to conduct a vision acuity test, and I'm going to get him to look at the Snellen chart and get his visual acuity. I don't have a chart today, but that's how I would judge his visual acuity. For that, also going to test his peripheral vision. So would you cover your left eye with your hand, please? And look straight ahead and tell me when my hand comes into view.
No. No. No.
Okay. And I will assess the other eye in the same way. The next thing that I'm going to do is I'm going to assess his pupils, excuse me, for accommodation, extraocular movement, and if his pupils are reacting to light. So I would like you to look straight ahead, please. Keep your head still and only follow this pen with your eyes, okay?
Okay.
Okay, 6 fields of gaze are intact. I'm going to test for accommodation. I'll follow the pen, please. All right, his eyes go together like they're supposed to. At this point, I would turn off the lights to assess his pupils. So I would come in from this side, make sure that they constrict like they're supposed to with the light and dilate when the light is moved away. After I've assessed his outer eye and assessed for Perla, I'm going to now assess his inner eye with a ophthalmoscope. So, Joey, what I'd like you to do is focus on something over there, and I'm going to look in your eyes with this light. Again, the lights will be off so I can assess his eyes. So I'll make sure the light is working. I'm going to look. Sorry. All right.
Yeah, that's good.
That's one. All right. Adjust it till it's clear. And I'm looking for the optic disc, the retinal vessels, the macula and the fovea to make sure I don't see any abnormalities in that as well. Okay. After I look, I'll now turn the lights back on, and I'm going to assess his ear. I will look to just generally as a look. Do I see anything abnormal? Any abrasions? Any cuts? Any swelling? Any bumps that could be causing him problems? I'm going to do, you can put them back on if you want. I'm going to do a whisper test for him. Joey, I'm gonna whisper something. Would you tell me what word I whisper for you, okay?
Okay. 99. 99.
Okay. So normal finding. I'm going to now do the Weber test on them. Will you tell me if you hear this in both ears, please?
Yes.
Okay. All right, now I'm gonna do the Rennie test on them. I'm gonna touch this, behind your ear. When you stop hearing noise, will you tell me, okay?
Yeah, okay.
All right, and after I do that, I'm gonna move it in front of your ear, and then when you stop hearing noise, will you tell me as well?
Yes. Stop. Stop.
Okay. And I would do that for both ears, and again, that's a normal finding as well. Okay. After I've assessed that, I would now move, to look inside his ear. I'm gonna look into his ear canal and see if I can see, his tympanic membrane, as well as just any findings within the ear canal. Tell me if I'm hurting you.
You're good.
And I can visualize his tympanic membrane and it is clear and gray, which is a normal finding as well. All right, after looking in his ear, I'm going to look inside his nose. Will you look up just a little bit for me? All right, and see if I can visualize his septum, and do I see any abnormal redness or swelling in the nose, any congestion that he may have. Joey, will you cover one nostril for me, please? All right, since the test is on, close your eyes for me, please.
Okay.
Tell me what you smell.
Alcohol.
Okay, can you do the same with the other one?
Alcohol.
Okay, thank you very much. It's all right. All right. All right, so since the smell is good, next thing that I'm going to do is I'm going to now inspect his mouth. So, all right, will you open your mouth for me? All right, I can see his tonsils. Will you say ah? His uvula moves like it's supposed to. Will you touch your tongue to your lips? I'm sorry, I meant to the top of your mouth. Top of your mouth so you can see underneath his tongue. All right, it looks good. There's moist. It's not overly red. It's not overly dry. I can check his gag reflex. I'm not going to, but I can check his gag reflex as well to make sure that that is intact. Okay, the next thing I'm going to assess is his throat. So I'm just going to look, general symmetry, where's the trachea, is it in a good place? I'm going to palpate his tracheal cartilage and his cricoid cartilage. Trachea is midline at this point. Can you swallow for me? Okay, he swallows without difficulty. At this point, I'm going to come around behind him. Joey, I'm going to touch your thyroid gland, and I want you to swallow for me, okay? All right, can you swallow for me? Okay, and it moves well. I don't feel any abnormal lumps or masses on this thyroid gland. Next thing I'm going to do is I'm going to palpate his lymph nodes. And I forgot when we were doing the facial exam, I would have palpated his frontal and his maxillary sinuses as well, and I could percuss those to see if they were full as well. The lymph nodes, I'm going to check his preauricular, his postauricular. Oh, I forget this one every time. His tonsillar, his submandibular, and his supraclavicular right here to check his lymph nodes for that. Okay, next thing I'm going to do after I do this is I'm going to inspect his chest. I'm going to start with a respiratory assessment. So I'm going to first just inspect his chest, and again he will be in a gown. He will not be clothed, so I will actually physically be able to see him, his skin, and assess that. So I'm going to first just inspect. Do I see anything that could cause a problem, like an injury, any deformity, any contusions, any bruising, any redness, anything that's abnormal on the patient? I'm going to inspect the front. The next thing I'm going to do is I'm going to palpate his chest. All right. Does any of this hurt when I touch it?
No.
Okay. I'm going to touch. Does any of that hurt when I touch it?
No.
Okay. So again, palpate, looking for anything that feels deformity, sponginess, subcutaneous emphysema when I touch it. Now I'm going to come around to his back and I'm going to check him for tactile fremitus. When I tell you to, will you please say 99 for me?
Okay.
All right, go ahead.
99.
Again,
99,
again,
99,
again,
99,
one more time,
99,
and last time.
99.
Okay, it vibrates like it should. I don't feel any areas of consolidation. I'm gonna percuss his back in the same manner, in the same kind of zigzag manner, to make sure there's not any areas of consolidation and that I hear a good area back there. All right, Joey, I'm gonna poke you on the back, okay?
Okay.
Okay. It's resonant like it should be. I don't see any areas of consolidation for that. And the next thing I'm going to do is I'm going to assess his breath sounds and listen for any adventitious sounds. So I'm going to ask you to take a couple deep breaths for me, okay?
Okay.
All right, deep breath. Okay. Deep breath. Okay. Deep breath. Okay. Deep breath. Deep breath. Last time, deep breath. Okay. All right. I did not hear any of the adventitious sounds yet, good breath sounds. I'm going to, at this point, come around to the front to perform the same assessment, give him a chance to catch his breath. I'm going to, again, I've already palpated. I'm going to check for tactile phremesis. I'm going to percuss, and then I'm going to auscultate for breath sounds on the anterior portion of the chest as well. Okay. Next, what I'm going to do is I'm going to now assess him for cardiac. So I'm going to, again, I've already inspected his chest, but I will continue to look. I've palpated, okay, nothing hurts, correct?
No.
Okay. I'm not going to do percussion at this time, but I am going to auscultate and listen to heart sounds. I'm sitting up. So, all right, so just breathe normally, okay? All right. So I'm going to listen to aortic, pulmonic, Erb's point, tricuspid, and mitral valves. Okay, I would listen with the diaphragm and the bell of the stethoscope. When I come down here, again, I can try to palpate the PMI. And it's not always palpable in all people, but I can try to see if I can see his palpate his PMI. All right, Joe, I'm going to ask you to lay down for me. Now that he's laying down, I'm going to again listen in the same order that I listened for his heart sounds. I'm listening for splitting of S1 and S2, murmurs, any additional sounds like S3 and S4. And again, I would listen with the diaphragm and the bell of the stethoscope. While he's laying down, I'm going to assess his peripheral vascular system. I'm going to put the bed at 30 degrees and see if I see any JVD. I can also put the bed at a certain degree that I can see the top of his jugular vein. And once I'm able to find that, I can then measure to the aortic arch and to evaluate his jugular venous pressure. 3 to 4.5 centimeters is normal finding for that. While he's lying down again, I'm going to assess peripheral vascular. So I'm going to check his pulses. I'll check his carotid on both sides. Okay. Check his carotid on both sides. Now I'm going to come around this side right here so I can reach him, but I'm going to check the other ones at the same time. So I'm going to check brachial, radial. I check femoral. I'm going to check popliteal, posterior tibial, and then dorsal pedis. All right. So all pulses are equal and 2+ for that. While he's lying down, I'm going to inspect his abdomen. Again, he would be unclothed, and I would be able to see his abdomen to the skin. But first thing I would do is again inspect it to make sure I don't see anything, any scarring, any injuries, any bruising. For that, the next thing that I'm going to do is I'm going to auscultate his abdominal sounds in all 4 quadrants. Okay. He has ballot sounds in all four quadrants. They are not, do not sound hypo or hyperactive at this point. After that, I can percuss. Come over here where you can see better. I can percuss and find down and find where his liver is. Can try to do the same thing to the side of the spleen as well. After that, I can come and I can palpate his abdomen. So I'm just gonna use light palpation. Tell me this hurts.
No.
Okay. Looking for pain. I can also perform deep palpation and try to locate his liver, his kidneys. Spleen is more difficult to locate, and also check for rebound tenderness with that. I'm gonna withhold that at this time on him because it is painful. It can be painful for that. While he's laying down, I'm also gonna check his abdominal reflex. That, and I'm gonna let this down. Abdomen moves like it should, so that's intact. Okay, Joey, I'm gonna ask you to stand up for me. Okay, and now I'm gonna assess his musculoskeletal system. So what I want you to do is come over here. You're good, face me. Okay, all right, so what I want you to do is I want you to take your head, look up, look down, look left, look right. Okay, does any of that hurt? Can you shrug your shoulders for me? All right, can you move your arms into like a windmill type of movement? Okay, can you put your arms out to your side? All right, I'm gonna try to push them down, don't let me, okay? All right, I'm gonna try to push them up, don't let me. Okay, take your arms and move out from the elbows like this. All right, does any of that hurt?
No.
All right, put your arms up like this. Try to push my hands, push against my hands. All right, good deal. Take your wrists, roll them over like this. Does that hurt?
No.
Okay. Take your fingers, spread them apart, make a fist. All right, I'm gonna check also his coordination here. I want you to do 1, 2, 3, 4, 4, 3, 2, 1 with both hands. 1, 2, 3, 4, 4, 3, 2, 1.
1, 2, 3, 4, 4, 3, 2, 1.
All right.
1, 2, 3, 4, 4, 3, 2, 1.
All right, thank you very much. Can you grip my fingers for me? All right, good deal. All right, you can let go. All right, can you turn around for me? All right, I'm gonna touch your spine. Tell me if any of this hurts. Does that hurt?
No.
Can you try to touch your toes for me? Bend at the waist. All right, thank you very much. You can lay back down for me. Oh, wait, I'm sorry, I forgot something. Do me a favor, walk back where you were. Can you walk to me heel to toe? Okay. All right, can you turn around and walk back on just the balls of your feet? All right, can you walk back to me on just the heels of your feet? All right, one more. Can you turn around and just walk normally, please? Okay, I'm able to inspect his gait here. All right, thank you very much. Can you lay back in the bed for me?
Yes.
All right. We're getting close. Okay, so what I'm gonna do is, can you move your ankles for me up and down? Are you pushing on the gas pedal? Okay. Push against my hand like you're pushing on the gas pedal. Pull up. Let me check both, please. All right, up. All right, can you bend at your knees? With both? Okay. Can you straighten this leg for me? And I'm gonna have you take your heel, put it on your knee, and push that down to your foot, okay? All right, and now can you do that with the other leg, please? All right, we already saw you bend at the waist, so I'm not gonna ask you to do that again, okay? Is any of that painful for you?
No.
Okay, all right. The last thing that I'm going to ask you to do is, can you sit on the edge of the bed for me? I'm gonna check your reflexes, okay? So let me see your arm right here, kind of just put it right here. I'm gonna check your bicep. All right, I'm gonna check your tricep. All right, I'm going to check your wrist right here. All right, I'm gonna check your patella. All right, I'm gonna check your Achilles. And then I'm gonna lick your leg up. I'm gonna check a Babinski on you, okay? All right, and I'm gonna do that on both legs. All right, did you have any issues?
No.
All right, this concludes my physical assessment.